Okay, guys, so we're in Wisconsin for 4 days, basically switching out gear and repacking, this time for 6 months. So we'll be out of the country for 6 months, and it's a bit of a logistical nightmare, especially packing our kite surfing gear and all of our activities. So we have our free diving fins, goggles, snorkels, kites, surfboards. Right now, we're trying to be task oriented. So we're starting out with all of our powders, medications, and toiletries. And we've kind of just spread everything out on the floor. These are some of our toiletries. I am training for a marathon in November. And because of that, we have a ton of creatine, protein, collagen supplements. And then we are bringing with us athletic greens for when we are in more rural communities and might not necessarily have access to a well-balanced vegetarian diet. So we're gonna go through all of this and see what we got. Okay, first up, marathon training gear. So this is going to take up a lot of space, unfortunately, but we will be getting rid of everything by November. So it's September now. We are going to go to Italy for a little over a month, and then we're going to Turkey where I'll be running the Istanbul Marathon. And so I need to pack everything that I need for all of my long runs, all the fuel, all the electrolytes, all the protein, all the creatine, everything. So these are my GOO chews. These are something new that I've discovered that I love. I have a sensitive stomach, and so fueling has been challenging for me because I don't tolerate most things. I used to use these jelly beans, which have also been amazing, and found the GOO chews that work great for me. So I am taking a bunch of both of them so that I don't run out of fuel at any point. These are heavy and massive. Next up is Tailwind. Tailwind is this new electrolyte hydration supplement that Lorenzo got me into. It's what all the ultra marathoners use when he's working ultras. So as a wilderness medicine specialist, he is the physician for different ultra marathons around the country. He swears by this brand, and FYI, we have no sponsorship for any of these brands. These are just what we use, and we're sharing with you what we use. And then we have our creatine and our marine collagen. So let's see. So I started taking marine collagen after an ankle injury. I had a posterior tibial tendinopathy, which lasted like 6 months. It wouldn't go away. It was driving me totally insane. So the marine collagen studies have shown that it actually might help with preventing injury and especially joint injury. So I figured, why not give it a shot? And marine collagen, because Lorenzo and I are pescatarians, I have, knock on wood, not experienced any recurrence of my injuries since starting this. Whether that has anything at all to do with the supplementation, no idea, but I've continued to take it. Microionized creatine. This has been associated with improved performance, both aerobic and anaerobic performance. This is something that I've been taking for years. I swear that it makes me feel better, stronger. You know, there is some good data to support it. Microionized because it's a little bit easier on the stomach. There are some side effects that you can't really ignore. Some people have difficulty sleeping. Some people obviously have GI issues, but I love microionized creatine. I take a much lower dose than Lorenzo. Lorenzo gets pretty geeky about the dosing. This is my Turkish tea. So in Turkey, it is pretty blasphemous to use tea bags, but I am bringing tea bags with me because I want to make sure I have enough tea. But that is all our marathon prep, exercise related
So we basically
gear.
travel with twist-tied plastic bags full of white powders, and I just label them and hope that TSA doesn't think we are drug mules.
Next up, and we are not sponsored, but AG1, if you want to sponsor us, we will certainly take it. But we have a lot of experience traveling in lower middle income countries, and because we're pescatarian, we just struggle sometimes to maintain a well-balanced diet. And since we don't know the regions that we're going to, and we don't know what the food situation will be like there, we've figured out, I should say, like when we're working and we are not well nourished, it is such a brain fog that comes over you. You cannot even imagine. You're tired, you feel just like heavy all the time, you can't really concentrate. And to imagine that people live like that and are expected to fully function while dealing with a baseline of some malnutrition. But because of that, we are bringing AG1 this time in addition to all of our proteins. So we're bringing 30-day supply for each of us. We are going to give it a try. We'll report back. We've heard excellent things about AG1, and obviously Dr. Huberman, Andrew Huberman, really supports it. We have a bunch of friends that use it. Thank you. Shout out to Rana and Ben, our two best friends, for getting this for our graduation gift. This is gonna be a huge help for us. So the other thing that I should say is that Lorenzo and I often get into arguments about him eating my share of food or whatever else it is. So I'm gonna label these as L and S, and that way S doesn't starve because L is over consuming. All right, so this is S's bag. Okay, I'm gonna seem absolutely off my rocker, but also I am Turkish. And not only am I Turkish, but I'm absolutely addicted to yogurt. Huh?
What are you putting in there?
These are stickers for kids when we're abroad.
Perfect.
Kids love stickers. It's like the easiest way to
Build rapport quickly. So on Dancitron, Zofran, really good nausea medicine. They've actually done a study comparing Zofran, the sublingual nausea medicine, and just ripping open a packet of alcohol swab and sniffing the alcohol scent. And the alcohol swab was non-inferior in the study to reducing nausea and vomiting in patients. So if you don't have Zofran, you can just sniff alcohol. Not the one you drink, but like cleaning alcohol. Next up, we have loperamide. Loperamide is over the counter. It's also known as Imodium. It is an anti-diarrheal. Just be careful when you take this because it can actually swing you into constipation. The antibiotic that I've been taking based on antibiotic susceptibilities in different places, it kind of changes. It used to be ciprofloxacin, but nowadays there's so much antibiotic resistance to ciprofloxacin that it's like a 1 in 2 chance that it's gonna not work. Azithromycin is what we take. It's 1 gram once for diarrhea. The large dose in and of itself can cause a little bit of queasiness and upset stomach. However, I found it to be very effective almost every time. However, most of the time anyway, the illness probably passes within 24 to 48 hours. So mixed signals a little bit about antibiotic stewardship, but that's what we do.
We should just say that we are physicians. Lorenzo is wilderness medicine trained. We have extensive experience traveling in lower middle income countries and living in these regions. That's why we bring so much with us, so that if we're ever in a situation where we need something, we just have it right in our suitcase and we can continue about our day. You should talk to your travel medicine physician to make sure that they prescribe you what you need for the specific regions of the world that you're traveling in and for the unique activities that you're doing. So for people that are working inside of a hospital, operating, it's a little bit different than someone that might be doing extreme sports, which is different than someone who's just traveling through cities.
Augmentin, another antibiotic that we take with us. This one is good for, say, like a dental infection, things that are more superficial, like skin type infections, and it's also used as monotherapy in some cases for certain diseases. No. So another medication that we like, and specifically for marine encounters, so say if I had the sea urchin spine and I started developing a lot of redness or swelling or other signs of infection, I would probably start taking doxycycline because it covers microbe called Vibrio vulnificus, which can give pretty gnarly infections, and it covers a lot of other things like MRSA and other skin flora. Some of the other medications that we take with us, or I take for myself specifically, is an injectable medication that I need to take for blood thinning, and I just take this, and it's called enoxaparin, Lovenox. Some of you may be familiar with this, and this is just for flight days, for very long 8-hour plus travel days, because I have a stent from a traumatic arterial dissection, and so just to reduce the risk of clots.
So in this bag, we have our cortisone, bacitracin, mupirocin, and our Vaseline, although the Vaseline does not want to fit, so it's going in here. And then I'm also packing a moxifloxacin prednisolone drop just to have as backup if we encounter any eye issues, which we shouldn't because neither of us are contact lens wearers anymore, but we have it for backup.
And these are just medications mostly. We haven't really talked about the other things that we bring. We talked about bandages. We also bring forceps, small scissors. Yes, and Neosporin can cause mild allergic reaction in the skin because of the compounds in it, so I prefer to just use bacitracin or mupirocin alone. There's a lot of things you could bring. You could bring shears, you could bring splint materials, sling materials, but then you start to get into like, what are you actually bringing it for? If I was covering a sport event, my med kit would be much more broad. I think sunscreen is an essential part of everybody's kit, especially first aid kit. I consider it part of the first aid kit, especially if you're going somewhere tropical, somewhere where you're going to spend considerable amount of time in the sun, which we tend to do. You want broad spectrum coverage that includes UVA, UVB coverage for your entire body. So I personally like, as it's not as convenient as the spray sunscreen, but the cream tends to stay on me, especially if I go in the water, and zinc-based sunscreens are the best. They stay on with a lot of water and sweating, and I usually put that on my face to reduce the risk of sunburn.